Good afternoon, everyone. Thank you so much for joining us today for the Youth and Family Homelessness Providers Preparing for the Upcoming Flu Season Amidst the Coronavirus webinar. I'm excited to welcome you all here today. We have a great group of presenters with a lot of information to share. So to begin, I would like to just first go over some brief housekeeping. You're all on mute, all of the attendees. So if you have questions or comments, please feel free to submit them through the question box. And we'll have different points throughout the presentation where we will be addressing questions. So definitely please submit them as you think of them. Additionally, we are recording this session. And so for Family Promise affiliates, the recording will be on the Family Promise website. And for those who are here supporting the National Network for Youth, I'll make sure I share that recording as well so you all can have access to it. So like I mentioned, we have a really great group of presenters from a bunch of different agencies here today. And they'll all sort of introduce themselves a little bit. And to continue, I would just like to share the agenda. So first, we're going to hear from the National Network for Youth. We'll then hear from Family Promise. We'll hear from Dr. Robert Marbit from USICH. We'll have some comments from Martha Montgomery from the CDC. We'll hear from the HHS from Cheryl Levine. And then, like I said, we'll have time for question and answer throughout, and then we will wrap up. So on that note, I'm very happy to go ahead and turn over the presentation to Darla Bardeen from the National Network for Youth.
Thank you so much. Welcome everyone. Again, my name is Darla with the National Network for Youth. It's my pleasure to welcome you to our webinar today, and a big thank you to Family Promise. We're proud to partner with you, and a double big thank you to the U.S. Interagency Council on Homelessness for really initiating this call. They're very passionate about getting kind of the most relevant information out about coronavirus and the upcoming flu season to homelessness providers across the country. So a little bit about the National Network for Youth. We really focus in four main areas: policy advocacy, youth partnerships and leadership development, public education, training, and technical assistance. We are a network of over 300 youth homelessness service providers across the country, and we also partner with young people with lived experiences of homelessness. You can check out our website to learn more about us. And now it's my pleasure to hand it over to Sandy from Family Promise.
Thank you, Darla. We're proud to partner with you and the National Network for Youth as well. And I just want to thank all of today's presenters and attendees for giving up some time out of their busy day to learn more about what we can do to keep those in our care safe and healthy. For those of you on the call that aren't familiar with Family Promise, I'd like to give you just a quick overview of our work. We are the premier national nonprofit addressing the crisis of family homelessness. We have 200 Family Promise affiliates located throughout the country, and they help families experiencing homelessness by providing prevention services before families reach crisis. We provide shelter and case management when families become homeless, and we offer stabilization programs once families have secured housing to ensure that they remain independent. Last year alone, with the help of over 200,000 volunteers, we provided services to over 100,000 people, 60% of which were children. Since our inception in 1988, we have served more than 1 million people, and it is our aspiration to change the lives of an additional 1 million children by 2030. I want to just point out that since the pandemic, I've been incredibly impressed by the Family Promise Network's laser focus on helping families. Our affiliates really didn't skip a beat in providing services. In fact, we've seen a ton of innovation and new programming, with many of our affiliates finding new ways to increase capacity. So it is with that lens that I think today's webinar is extremely important in helping our collective efforts to ensure that families remain, again, safe and healthy with the upcoming flu season. And with that, I will turn things over to Dr. Marbit.
Thank you very much, Sandy, and thank you, Darla, for you all co-hosting this event. We really appreciate it. I have to say, you know, we want to do a little micro celebration of success today, which is sort of weird to think about that in terms of pandemic. But if we had all go back in time the last December and said there's going to be a pandemic that goes all over the world, all the continents, and it's going to hit the most vulnerable, both medically, physically, emotionally, economically. And how's that going to work out? And what do you think the predictions would be? Most everybody would have had just very dire and catastrophic predictions. And because of you all's hard work on the front line and just the absolute fabulous guidance of CDC, we are doing so much better than we could have ever imagined. Doesn't mean bad things aren't happening. Doesn't mean they're not challenges. Doesn't mean we have to, challenges ahead of us. But compared to what could have been, it has been amazing work of frontline providers all across the country. And I've been to many of your all's locations. I've been to many of the family promises in the last 8 weeks in particular. And in the innovation, the creativity has just amazed me. And so, both want to thank you for that and celebrate that. As for I always get asked sort of the numbers, and there's probably always a slight lag and delay of reporting of these numbers. But as of this morning, we had 5,742 cases within the community of homelessness that were positive, and we've had 200 deaths since the beginning. For me, one death is just way too many, and 200 is just horrific. But again, compared to what other congregate groups are, the general public, what have you, the numbers are just incredibly better than expectations. And it's because of the hard work of the frontline providers and being very careful and diligent to follow the CDC protocols, not just the sort of public protocols we all know about of mask and 6 feet and hygiene, but the ones that relate to the different programs, depending on what type of program you have. Everything from how we eat lunch together, how we eat breakfast or dinner together, how you do case management, how we transport individuals around. What do we do when we have a positive case and isolation and quarantine? All those protocols, which have been just fabulous from CDC, and the really right, I call it aggressive following of the CDC guidelines, and we've just had really, really good success so far. I'm very aware that people are worn out now. Front lines are worn out. Volunteers are worn out if you still have volunteers. Many programs chose not to even have stop volunteer programs and not have volunteers on site, which then adds more load to the staff that's left behind. Then, especially in the first 2 or 3 weeks of a community getting hit, we had a lot of isolation and quarantine of staff, then further dropping staff down. And initially, at least, fundraising was challenging, PPE was challenging. If you ran an operation with food was challenging. All the while, the demand was going up. So the demand was going up, and virtually every measure of operational resource was either tight or going the other direction. So it is just amazing efforts of success to get to that. And I've been asked a lot in the last 4 or 5 weeks because our numbers are better than the congregate. They're better than the general public. I was talking to Mayor Garcetti last week, and he says we're in the homelessness community, we're 50% better than the general public. And I think it's the real following of the protocols, but more importantly, because of all the early phone calls that we all had, the protocols were put in place before the virus got to the community. And that's probably been the absolute key success, was really being fast, firm, and quick in establishing protocols and customizing it to everybody's operation. Because, the CDC guidelines make, when you start talking about some of the layout of buildings, that becomes challenging for some, and others, some of the protocols for meals become challenging. But we've worked through all that, and it's been just fabulous. So the go forward message is we got to continue to be vigilant. And I really think I was able to, my senior staff and I, Darren, some of you know Darren and Roxana, the three of us had a video meeting with Dr. Fauci a couple weeks ago, and we were just talking through, the particulars of sort of how we've done so far, how much longer is this going on, and what do we do next. And he really brought up the importance of, we can't sit back on our laurels of how good it's gone so far relative to other communities, but we have to figure this all out and keep the vigilance up. And he thinks sort of February is a target time for when you start getting many communities by then, if everything stays on track as it is now, that will have some, real wide distribution vaccination going on at that point in time. And that by then, many communities, not every community, but many communities will start to get up to that herd immunity that allows us to start resuming to normal. So, we still got months to go of this, but we know what to do. We know how to do it. We got to be vigilant and not slip. A quick sort of PSA on that. I, I I and a couple other people handle all the mitigation. So anytime a place starts to get yellow or orange, we don't want it to get red hot. We call in. Sometimes we site visit. Sometimes we do video and check. And in the last 8 weeks, all but one facility flare up has been caused by eating. So really be conscious of your how you feed, how you eat, how food is distributed, and that's been the sort of epicenter of all the little breakouts we've had. And fortunately, we've been able to control all of them up to date, but we need to be very careful. And the big new one is the flu shot and getting ready for flu season. The idea that you have two upper viral infections, one that's very contagious generally, and another one that is very dangerous, and that many of the same symptomatic packets are presenting at the same time, is going to create a series of systems issues, and it's going to create a series of individualized issues. At a system level, any given flu season can kill, 60,000 up or down off that number, and send hundreds of thousands of people to the ICU anytime. And then if you add that in with COVID, and then you add in the testing complexity that for the first few days, both the diseases, whether it's flu A or flu B, very much feels and looks like COVID to an untrained eye. And so you'll have 3 or 4 days of an identification issue. And then when you get to the individual level, what we know, and from past upper viruses, SARS and MERS, that if you have flu season with a coronavirus going on at the same time, that your chance of really bad outcomes increases. If you get flu first, your immunity's down, then you get COVID, or the reverse, you get COVID and then you get flu, and then that sort of compounds the problems with the therapeutics on the other side. So we have both the system and an individual level of challenge, and so that's where the flu shot becomes so important this season. And it's there. We have generally pretty good numbers on flu shots. Say it's a little less than 50% in most years. But what we know in the community of homelessness is we generally run about 1/3 of what the general public is at. And again, those are not great numbers, not super scientific. That's sort of a eyeball number. If there's some places where we've had higher success, some we've had less. But if you call it 1/3 and you call it 45% for the general public, that means we only have about 1 in 6, 1 in 7 people vaccinated. And not everybody is medically appropriate for vaccination, but if we don't get the vaccinations up to closer to 60%, or preferably a little higher than that, we stand a risk of really having complications in the fall. The general public has all that too, but with our higher level medical acuity and other challenges, that makes that even more complex. And so we really want to get out the message of the benefits of a flu A, flu B shot. If you're medically indicated, not everybody's medically appropriate to get the shot, but if you can, we will. And there are two sort of best practice takeaways, and then I'll pass it over to Martha here, is what we know from the community homelessness, generally trying to get to a site, whether it's a community center or a drive-through, that a lot of places are talking about for this year in order to stay outside. That probably won't work with our community because so much of our community lacks both public transportation options, not being in the right location, or do not have a vehicle themselves. And so we're trying to get as many agencies to contact your local health authority and to say, we're here, we're ready, can we have an on-site vaccination program? So we know that going somewhere else really reduces our community's participation. The second thing we know is if we don't talk it up and explain why it's important for most people, again, not everybody should have a flu shot, but most should, is if we don't talk it up and really promote it, we'll have a situation where we have 8 or 9% participation. I was at a very large location in Houston 2 weeks ago, and I asked them, I said, oh, we do flu shots every year, and they have a place about 1,100 people in all their programs, and last year's vaccination had about 80 people participate. And so we can't just say, hey, come in on the corner room one-on-one, go get your flu shot. We have to talk about it in advance. We have to talk it up. We have to explain why it's important, why if it's medically appropriate, we really would encourage you to take it and such. So I want to again thank you very much for this, and I'll pass it over to Martha at this point, and then after that we'll be available for a round of questions before we go to the next speakers.
Great, thanks so much, Dr. Marbut. Yes, this is Martha Montgomery from CDC's Homelessness Unit, and I really want to thank you all for having me on today, and thank you all for the work that you do each and every day. So we can go on to the next slide. So it's been a little while since we've talked. I wanted to start by sharing the latest information on COVID-19 case counts in the United States. This is for the entire population. As of yesterday, there have been 5.3 million COVID-19 cases reported in the United States, and this slide shows the number of new cases by day since January in the blue bars, and a rolling 7-day average shown by the orange line. So you can see that in the last couple of weeks, that the number of cases appears to be declining from a peak at the end of July. What this doesn't show is all of the regional variability that is observed in individual states or cities or towns. But overall, I hope that this is a positive direction and that we continue to see a decline. You can go to the next slide. So shifting over to influenza, I also have some numbers from last year's influenza season. These are the preliminary burden estimates from October 1st of 2019 through April 4th of 2020. Starting at the bottom of the pyramid, there were between 39 to 56 million influenza illnesses with around 18 to 26 million medical visits, and between 410 to 740,000 hospitalizations, and an estimated 24 to 62,000 deaths due to influenza last year. And what this really means, which I think Dr. Marbut has already covered pretty well, is that each year influenza poses a significant burden to the healthcare system. So it's additionally important this season as we expect influenza and COVID-19 to be circulating through communities at the same time to make sure that people get vaccinated for influenza so that we can minimize the burden on individuals and on the healthcare system as much as possible. Go to the next slide. One thing that is concerning, however, are the racial and ethnic disparities that we see in influenza vaccination coverage. And as I don't have to tell you, I'm sure we also see racial and ethnic disparities among people experiencing homelessness. So this is particularly important for us to bring awareness to and to address as best we can. We can see here from data from the National Health Interview Survey in 2017 that the rates of vaccination coverage for Black and Hispanic populations were lower than for whites, no matter what age group you look at or whether people are at high risk or not. And we know that reducing existing disparities will be an important to protect minority and at-risk populations for both influenza and for any future COVID-19 vaccine. Next slide. So you might be wondering what CDC is doing to increase influenza vaccine coverage for the upcoming season. The first thing is trying to maximize the availability of vaccines. So we're expecting over 190 million doses for the US market. That's the star in the graph on the right. You can see that this is an increase over previous years. And to help with this, CDC is purchasing an additional 2 million pediatric and 9.3 million adult doses. CDC is also planning operationally to increase vaccine uptake, including conducting outreach to people at higher risk of infection or at higher risk of severe disease, planning for potential need for social distancing, like during the flu clinics, and also extending influenza vaccination season. Third, the CDC will be enhancing communication outreach to align with COVID-19 messaging and to reach African American and Hispanic communities. Go to, oh, and I think that is my last slide. So I think the last thing I wanted to mention is just that the success of this year's efforts to combat influenza really depends on us working together. And your organizations can help support influenza vaccination during COVID-19 pandemic by sharing some key messages extending into December or later. And these messages are, the first one is that getting a flu vaccine is always the most important thing you can do to help protect yourself, your loved ones, and your community from flu, including reducing the risk of serious outcomes that can lead to hospitalization and death. The second message is that this season, getting a flu vaccine is more important than ever, as it will not only protect against flu, but it will also help to preserve scarce medical resources for healthcare providers and COVID-19 patients. The third message is that getting a flu vaccine is an easy and safe way to do your part to fight flu, whether it is to protect yourself, your loved ones, your community, or the global community. So whatever you and your organizations can do to help us spread these messages with your staff and with the population of families and youth that you serve, it will really go a long way. And if anyone is interested in learning more about the upcoming influenza vaccination recommendations and clinical guidance during the COVID-19 pandemic, CDC will be hosting a webinar this Thursday at 2 p.m. Eastern for clinicians, and I can share that link to register for the webinar. And with that, I'll hand it back over.
Thank you so much, Martha. That was great. And I'll definitely make sure that the audience receives that link if they're interested in joining. So I will go ahead, and I don't have any audience questions yet. So if anyone in the audience wants to submit any, please feel free. But I'll go ahead and start, I think, with Lindsay, if you have any questions for Martha and the CDC that you wanted to address, and then we can look to Darla and Andrew.
Thanks, Kayla. Our first CDC question is there any risk for a healthy person who is COVID-19 positive but perhaps asymptomatic to receive the flu vaccine? And if yes, what are the potential complications or risks?
Sure. So I think that it kind of falls into a gray area, which is, I'm sure, why the question is coming up. It's pretty clear that if you do have COVID-19 and are experiencing symptoms, not to get your flu vaccine at that time, just wait until you're feeling better. For people who don't have any symptoms, I think it would be important to wait until you can follow the end of isolation guidance to determine when your illness is kind of considered over. And I would wait that period out before you go to get a flu vaccine, because it would sometimes symptom onset can be delayed. So you just want to make sure that you aren't kind of what we call pre-symptomatic and will end up developing symptoms later on.
As a follow-up to that question, is there any suggestion or guidance that a person get tested for COVID-19 before receiving the flu vaccine if they believe there's been exposure and they're still at that point asymptomatic?
So if somebody has been exposed and are following the quarantine guidance, then I think getting a test in some cases can be helpful, but really anytime during that quarantine period, you could test negative and then the next day you end up testing positive. So there's sort of a limited value to getting tested. I think it is important to wait until your quarantine period is done, and there is guidance on the CDC website for calculating when your quarantine period is over. It's the short story is 14 days after your last exposure. So I would wait for that period before you venture out to get a flu vaccine.
Thank you. With the potential for a COVID-19 vaccination in the future, will there be any risk to receiving both vaccinations?
That's a good question. I think given sort of our limited knowledge about the COVID vaccine and what will be available and what the different formulations will be, there might be more than one. I think it's a little too early, but as that comes out, just pay attention to our website, CDC's website, for more information as we learn more about the COVID vaccine.
Thank you. Do you recommend getting flu vaccines earlier this year, perhaps in August instead of in October or November?
Sure. So I believe that the Advisory Committee on Immunization Practices, or ACIP, which comes out with the flu vaccine recommendations each season, they have not yet voted on this year's flu vaccine recommendations, but in general, CDC doesn't anticipate any change to the timing of vaccination. But actually, the period of when you could start getting a vaccine, like September, October, is actually just around the corner. It's we're already in the middle of August. It seems like it's gone very quickly. So, yeah, wait a couple weeks, but in September and October would be a good time to look to get vaccinated.
Thank you. And in many cases, large-scale vaccination opportunities are available at workplaces and offices where there are large groups of people. Are there any plans for how the flu vaccine will be offered in communities where there may be large-scale office closures or workplace shutdowns?
Right. Yes, I think that is definitely going to shift the way that people receive their flu vaccines this year. There is a website called vaccinefinder.org that has more information on where you can go to find a flu vaccine. So that's vaccinefinder.org.
That's a great resource. Thanks for sharing. Those are, actually, I'm sorry, one more question.
Yeah, this is Robert. Can I jump in on that? Just that
Sure.
We were talking, we've had several rounds of meetings on that, the last question, and we really think it's very important that you work with your local public health authority. That will be the fastest and quickest way to source an on-site vaccination program. So we've talked a long time about being very close to your emergency manager and your public health authority. On the flu shot, we need you to be very close to your public health authority and invite them to your location. Many will do it. And there are a variety of funding programs that are around this already out there for low income, special vulnerable groups, et cetera. So I would start by always inviting onto your location whenever possible, because that will hopefully increase the participation rate.
Great, thank you for that, Dr. Marbut. There is one final question related to the CDC, and that is the potential long-term effects of COVID-19. It has been mentioned that heart problems may be one of the lingering effects, and one of the attendees was curious if that was true.
Yes, this is something I've tried to find definitive information on, and I don't have much of a satisfying answer, unfortunately. I think that it's still so early on. There are clearly reports that people have highly variable responses to infection, of course, anywhere from asymptomatic infection to very severe illness, and that some people recover very quickly and others continue to have long-term symptoms that seem to linger. But I think that we still have a lot to learn about some of the long-term consequences of COVID-19.
Thank you so much, Martha. That concludes the CDC question portions that I have, Kayla.
Thank you, Lindsay. Okay, I'll definitely go ahead and hand it over to Darla and Andrew. Do you guys have any questions you wanted Martha to address?
Yeah, there's a couple of questions. So one is, what are the isolation protocols for COVID-19 if a family unit is tested positive, or versus if one or two family members test positive? And the second part to that is, are isolation protocols different for flu for families?
Sure. So the first question about isolation protocols if multiple people in a family are ill. So for any family members that have not tested positive and don't have symptoms are definitely going to want to be separated. So people who are diagnosed with COVID should have separate sleeping space, eating space, to the extent that that is possible. And I think the second question was on isolation protocols for influenza.
Yes.
So I think that there's a lot less posted, of course, on influenza, because we've kind of been inured to it over years of seeing influenza every season, even though it is quite a serious illness. But the transmission is very similar as for COVID. It's respiratory. So anyone who's exhibiting, and the other thing is the symptoms are very similar for COVID and influenza. And so anyone exhibiting symptoms of either one, or if you've been diagnosed with influenza, you're going to want to follow the general, hand hygiene is going to be helpful. Any kind of physical distancing from family members, those are also going to be helpful for preventing transmission for influenza.
Great. And another question is, are there requirements, guidelines, or best practices in terms of teachers or homelessness providers, staff getting the flu vaccine?
Sure. So we definitely recommend anybody who's able to get the flu vaccine to get the flu vaccine this year. We want to encourage that as much as possible. As far as requirements, of course, that would come down to any sort of local or organizational policies.
And then another question is, in terms of being best prepared for flu season in the midst of COVID, how can providers tell the difference? Are symptoms different? Is there any kind of screening difference or recommendations from the CDC?
Sure. So the symptoms are going to look very similar between the two. I don't think that there's no single symptom that's going to very clearly differentiate the two. CDC has developed a test that can check for flu A and flu B as well as SARS-CoV-2, which is the virus that causes COVID-19. And this test is going to be available at public health laboratories across the country. So I think that test will be helpful to try and differentiate between influenza and COVID-19 and to figure out which virus is spreading where within a community. So that would be something you could talk to your local health department about, because that's where the testing would be available.
And do you know how long it'll take to get the results of those tests?
That I do not know. I think that will depend on a lot of different factors that I cannot predict.
Yeah. One final question is, one of the our attendees said that they heard there are 2 different types of flu vaccines, one that's recommended for adults 65 or older and one for those who are under the age of 65. Is that true? Are there different types of flu vaccines?
Yes, there are different types of flu vaccines. This is not my area of expertise. So there's a whole host of different flu vaccines. I think that the difference for people who are 65 years and older is that they have a higher dose to correspond with a lower immunity that we see in older adults. And so it is more protective for older adults. And then there's a variety of other flu vaccines that are manufactured. We do have an FAQs for the upcoming flu season on our CDC webpage, and I can think to share that link as well. And that has a little more information on the different types of flu vaccine options.
Great, thank you. That ends my questions for you.
And I just have one more that I got from the audience during the past few minutes. So one of the attendees asked, they got some pushback on the flu vaccine because someone had gotten the virus from the vaccine. And so how would you, best address that concern? Do you have any recommendations around sort of encouraging them to still get it anyway?
Yeah, this is challenging. There is a lot of resistance, or there's some resistance to getting flu vaccine. People seem to not like the flu vaccine in particular more than other vaccines. So one thing I can do, I think that we have a lot of different resources on flu vaccine messaging and how to encourage people to, whatever their concern is, whether it's getting flu from the vaccine, which is not possible, or any other concern that they might have. And let me look up and see if I can find a more comprehensive resource that I could share out with the group.
That would be great. Thank you so much, Martha. That was really helpful and really informative for our attendees. So I really appreciate that. And we do now have Cheryl on the line. So I'm going to go ahead and share her presentation and hand it over to her.
Hi, good afternoon, everyone. Sorry for joining a little bit late. Just double checking you can hear me okay?
Yes, you sound great.
Okay, good. And I'm guessing you'll advance my slides. So I'm Cheryl Levine. I'm with HHS ASPR. So just a little background. We can go to the next slide. So just a little bit of background. So HHS ASPR is the Office of the Assistant Secretary for Preparedness and Response. And so we sit with the Office of the Secretary for Health and Human Services. And so like my CDC colleagues, we've been very busy working on the 2019 novel coronavirus. And next page. So just a little background. If you're not familiar with ASPR, we are our mission is to save lives and protect Americans from 21st century health security threats. So we have different offices. You might be familiar with BARDA, the Biomedical Advanced Research and Development Authority. That's one of the agencies within HHS that's busy partnering with industry to make sure we develop things like vaccines for coronavirus. And we also have the National Disaster Medical System, where we deploy intermittent medical professionals to go and respond. And those folks have been very busy supporting the healthcare system around the nation as we've been working to address the coronavirus and other types of public health emergencies. And next page. So just a little bit of background on specifically my role. So my role is directing our program on at-risk individuals. And we do have some authority with that with HHS under the Public Health Service Act. There are requirements that we work to address the needs of at-risk individuals. And under the Pandemic and All Hazards Preparedness and Advancing Innovation Act, which is a really, really long name, which is our piece of statutory authority that got reauthorized in 2019, there is specific language that describes what in the world we mean when we say addressing the needs of at-risk individuals. And so that language under this section 2802 I've got included here for you talks about taking into account the public health and medical needs of at-risk individuals. And it goes on to define some populations. It specifically calls out children, pregnant women, older adults, people with disabilities, and then it says, and others who may have access or functional needs in the event of a public health emergency as determined by the Secretary of HHS. So we do have some requirements to be working on all the time, and specifically for public health emergencies to address the needs of at-risk individuals. And so on the next page, so a little bit about this term, access and functional needs. So this is, if you're not familiar with that, if you haven't heard that term before, it's kind of a concept, it's kind of an approach. We want to make sure that everyone has access to services and supports in the event of a disaster or a public health emergency. So some folks may have some challenges getting access. And then borrowing from the functional limitations, more of a kind of a disability focus, we kind of combine these two terms, access and functional needs. So everyone needs to have access to supports and services in a disaster or public health emergency, and some people may have functional limitations. So at-risk individuals with access and functional needs can include a whole bunch of different people. This can include individuals experiencing homelessness, people with limited financial resources, people with chronic health conditions, people with limited access to transportation, people with limited English proficiency, and so on and so forth. So there's a lot of different populations, and people can fit into multiple of these different sort of descriptions. So we have lots of work to do to be thinking, be thoughtful, be proactive to make sure that we're addressing the needs of at-risk individuals in all the work we do, which, as I mentioned, is a requirement. So next page. Okay, so what have I been doing? So I have been busy with my little team, which is very, very small, but thankfully with the help and support of some of my colleagues, we've been able to deploy some people to support me. So I've sort of been situated with the community mitigation work group. You know, they kind of coordinated this. This has been just large scale national global response that all hands on deck. So we ended up for a while being organized under FEMA. We're back organized under HHS. And I'm working with a group that focuses on community mitigation. And so I've had folks from our Uniform Public Health Service come to support me. I've had colleagues from FEMA spend some time supporting me. And then some of my HHS sister agencies have let me borrow some of their fabulous personnel to support the work that we're doing. So I'm very grateful to those folks for that support. Next page. So what have we been doing? So we've been busy, collaborating. So a lot of what I do, I'm kind of a networker. I'm kind of one of those people who knows people, or if I don't know them, I can figure out how to find them. So I've been doing a lot of work to make sure fostering relationships, thinking about, partners we have and new partners, and how to build collaboration to address those resources and to support the needs of our stakeholders. So a lot of that. And then again, sort of leveraging partners. How do we create resources and guidance, the things people need to figure out what in the world to do during this crazy pandemic where we've never quite seen this before. And then a couple of specifics. Early on with the response, we were thinking a lot about individuals experiencing homelessness, and quickly learned also that there were some challenges with nutrition and food insecurity. And so we've created some resources to be able to address some of those needs and try to call some of that out. And then also I've been building these things called journey maps, sort of a resource to talk about how to serve the needs of different at-risk populations as they maybe intersect with the healthcare system for care and treatment for COVID-19 illness. So next page. So all of these resources are parked on our HHS ASPR webpage. We have a specific place dedicated to the COVID-19 novel coronavirus disease. And so all of our resources are here. It's a webpage with these little kind of windows that talk about sort of what resources you'll find behind that window. And there's one specifically we started out, as I mentioned, thinking about some of the nutrition and food insecurity. So we've got meeting the needs of at-risk individuals with an image of someone receiving a hot meal there. So that's where you can find everything. I'm going to mention some of it briefly for you now. So on the next page, okay. So first of all, we've kind of really worried about what's going to happen with your organizations. For those of you who support the needs of individuals experiencing homelessness, the CDC was providing guidance, and we knew that things were going to change, and there was going to be some resources that were probably needed to support some of the work that you do. So we worked with all of our partners and created a resource. I mentioned that journey map, thinking about what are the different programs that do support individuals experiencing homelessness? What are the different funding streams that are connected to those programs? Are there some partners who maybe need to know about this to be able to connect the dots? And what are some possible pathways? So if someone is, whether they're previously, receiving support from a homeless serving organization or a shelter or in transitional housing or in a homeless encampment, what was going to happen as they entered the healthcare system. So we have a resource on that. And then my partners, FEMA and HUD, also put together this funding waterfall, we've called it. There's another document that talks about how to use that different funding. So on the next page, if you can advance. So this is, I was mentioning the journey map. So we wanted to think through what would happen for someone, an individual or perhaps a family who would then perhaps be tested and or be symptomatic and end up receiving care or treatment during COVID-19. Someone may be COVID positive, they may be COVID negative, they may have been exposed. Not that long ago, we were setting up this kind of new care system. We realized that the numbers could be quite significant. And so our colleagues were working to build something called these alternate care sites. We weren't even sure what those were going to be. We weren't sure if they were going to be places for people to convalesce, if they had been exposed and needed somewhere safe to be, or if they were going to end up being more like a field hospital. So we kind of put all this into a picture to think through what would happen to someone, specifically people who have come from, maybe a shelter or an encampment, and then ended up receiving care and treatment for COVID-19 illness. What we wanted to do was make sure we were thoughtful about what happens when they do leave the medical system, to be able to connect to supports and services so that they could return to places where they could receive additional supports and services, and maybe even connect to permanent supportive housing. So that was the idea behind this resource. And then on the next page, let's see. So that's just a summary of those resources. So the other thing I was going to talk to you about today was a different resource. So this is our community-based organizations resource during COVID-19. So I'm moving away from that resource on homeless programs. So this one is a little bit more of a general set of resources. So building on, we knew that the CDC had worked really hard to kind of create a resource on, I think it was reopening again. And that was sort of a general high-level planning for phases to return to, different phases of getting things back and running. And that also, I think our CDC partners are working on some very specific, more tactical resources. So we kind of played to the middle. What are some of those kind of middle ground resources that would be helpful for people to have to think about what to do, how to return to your operations, how to think about your workforce, how to think about your clients. So we created this community-based organizations resource. And what we did is we really kind of thought about, what are the buckets of information people might be needing for themselves as leaders, as folks who run community-based organizations, and for their staff and their clients. So we grouped them into kind of 4 type of buckets. So I'm going to talk you through these different resources. So overall, the high level resource is really thought of as sort of thinking about what to do in terms of adjusting to physical and social distancing as we're kind of living through this COVID-19 pandemic, but also wanting to maintain those essential supports and services that your organizations represent for different at-risk populations, including individuals experiencing homelessness. So let's go to the first section. And I'm kind of following along with you, thinking about what's right in front of me. So the first section talks about equipping community-based organizations for returning to work. So this was my kind of return to work section, what to do about the workforce and the workplace. So we wanted to collect the resources on really essential things just about that first step of returning to work, how to communicate effectively with staff, what to do about the workplace. Like if we do need to come back to the office, what does that need to look like? How can we configure that to be thoughtful of safety? Implementing flexibility and how to protect staff. Thinking about using technology. It doesn't work for everything, but really we're kind of in this 21st century technology world now, and how can some of that be applied to the work we do day to day? And making sure we address behavioral health needs and supports always, because this is just a very difficult, stressful time for ourselves and our families, making sure that we're very mindful of always reconnecting and supporting people. So on the next page, I'll just call out one of the resources that's included there. So on this page where we've collected the section on thinking about kind of returning to work, the workforce and the workplace, we've got a bunch of different resources. We gathered what we thought would be really helpful, and we synthesized them for you. So it's kind of a high level of some essential resources. So here's one example of something we wanted to highlight. And so this is tips for enhancing behavioral health during a crisis. And so this is a resource that, we want to make sure people are thinking about effective behavioral health management and how to, as a leader, how to make sure you're modeling that and sharing that with your staff. Things like communicating calmly, often and clearly with staff, establishing and maintaining clear boundaries between work and rest. I know many of us just are working tremendous number of hours, especially since we are doing a lot of telework. So we need to make sure we think about work and rest and kind of having some, protective barriers to keep our own mental health and behavioral health supported. And then engaging in self-care practices. So that resource on returning to work and workforce and workplace has a bunch of different resources that are synthesized sort of to highlight some different activities. And one of the important ones is connected to behavioral health support. Okay, so we'll go to the next one. So the next set of resources we've pulled together is a synthesis thinking about assessing client needs. So this is supporting clients and family caregivers during COVID-19. So this is, again, for a general audience of community-based organizations, and it pulls together different resources on things like social distancing and isolation for clients and caregivers, engaging in telehealth best practices and resources for clients, families, and caregivers, and additional resources and considerations. So there's a bunch of different information that we synthesized here if you go to the webpage. And one of the resources, I'll highlight one of them for you again on the next page. So for example, one of the resources we highlighted is the SAMHSA Disaster Distress Helpline. And if you're not familiar with it, this is a really great resource. This is a nice thing if you just, it's late at night and you've got a client needing some support and you don't have someone who can communicate with them directly. This is a great thing to have memorized, to be able to hand out or send out or text out. The Disaster Distress Helpline is available 24/7. It provides crisis counseling to people experiencing emotional distress, due to things like a pandemic or a disaster. And you can call or you can text to be able to reach a trained crisis counselor. So we've, again, synthesized those resources that we thought were really essential and helpful for assessing clients' needs and supporting clients. Okay, and then the next page. So the next section that we developed is a synthesis of resources on technology. So again, here we are, we're trying to socially distance, we're doing a lot of technology, and technology is good and it's bad. There's an opportunity to be able to do a lot of innovative things, but there's also some challenges and some new barriers that are created by working in this new technology focused sort of approach. So we wanted to kind of synthesize some of those resources and help explain some of the new ways of doing business. So things like, and there's other information here as well, also leveraging existing partners to continue to provide services. Since we're all remote, it's a really good time to kind of know how you and your partners can leverage each other's expertise and resources to be able to kind of continue to do the work that you would do every day to support your clients. Things like supporting alternate care sites. What are other ways of doing work or other places work can take place? And then a lot of focus on technology. So telehealth, health information exchanges, including all these really great resources like telehealth toolkits, behavioral health specific telehealth guidance, and recommendations for using 911 during a telehealth session to be able to refer clients for immediate needs. So that section goes through a bunch of different information on technology and leveraging partners. And then on the next page, I'll highlight one of those, which is the new telehealth.gov webpage. So everything has been kind of folded into this one place. So there's a new telehealth website that the government put together. So all the different partners' information are kind of synthesized here. It has a lot of toolkits, which I think are really important. So there's sections on for patients and providers, and there's so sections on sort of patients, sections for providers, and a bunch of these different toolkits and resources that can help us implement effective use of telehealth and technology resources to continue to deliver different supports and services using technology. Okay, and on the next page, so the final section is thinking about disasters and emergencies. So we didn't want people to let you go without reminding all of us that, you know, even though we're really working hard to understand and learn and shift our practices to be able to work in this COVID-19 environment, that does not, unfortunately, prohibit other things from befalling our work in our life and our communities. And so here we are in the throes of hurricane season and wildfires and trade shows, and all these things are happening. So we need to continue to prepare for and plan for how to address other types of disasters and emergencies that may occur. And so this is sort of a synthesis of resources and programs and partners that can be really helpful in thinking about building your capacity to address disasters and emergencies. So there's some information here on building capacity, working with partners, some information on, for example, HHS, we have our hospital preparedness program. Through that funding, we have the Healthcare Coalition. So there should be a set of people in your community. Our role is to think about the public health and medical response. So in your community, there should be a set of partners already there planning for disasters and emergencies and surge requirements. And so if you're not connected there, that might be a good place to plug in. And the ways to communicate, identify, and locate other at-risk populations during emergencies. And so one of the resources on the next page, so we highlighted here a toolkit that I built several years ago in partnership with colleagues from HUD and the Veterans Administration. We have this really nice toolkit that already exists on disaster preparedness to promote community resilience, information and tools for homeless serving providers and professionals. So if you haven't seen this before, I highly recommend it. It's a great resource. It's very thorough. It's kind of 3 toolkits in one. It has a section on building an inclusive emergency management system. It talks about, there's a section specifically for homeless serving providers on planning for your community and continuity of services. And then there's a section that I led that's a little more focused on healthcare providers. So guidance for healthcare providers on preventing surge, coordinating care, and mobilization of medical response. So this is a great resource that's already out there. So this community-based organizations toolkit is really a synthesis of a lot of great resources. We kind of pulled in what we thought was essential, summarized them for you, kind of packaged it in a way to kind of bucket things into groupings that we thought would be most effective to help you find the things you need to do the work you need to continue to do. And then on the next page, just a little bit of what's coming up. So I've mentioned we have this webpage specific for COVID-19 with these different resources that we've already built, work on addressing sort of that journey map I mentioned on programs to support individuals experiencing homelessness, resources on addressing nutritional requirements and food insecurity, the community-based organizations resource I just went through with you. We're also working on some additional resources. I've got another kind of journey map coming out, thinking about adults with disabilities who live in community-based settings, sort of a discharge planning resource for that population. And I'm also in the middle of a telehealth webinar series. So we've been doing, partnering with HUD, a telehealth series for community-based organizations. We've kicked it off last month with an introduction to what is telehealth. Our second webinar is going to be next week. We're going to focus on accessibility, thinking about, again, access and functional needs, accessibility for people with disabilities, as well as thinking about cultural and linguistic competency, access for people with limited English proficiency. So that'll be our next webinar. And then in September, the final one will focus on again, some of the other challenges that I think are really particular to the populations you serve. We're going to focus on individuals experiencing homelessness and rural, remote locations, and folks who just have, how do we access technology for some populations who maybe just don't have a device. So we've gone through sort of what is telehealth, accessibility of telehealth, and then the third and final telehealth webinar will focus on some of those harder to reach populations and some of the resources to make sure that people are able to maintain connectivity. And so all of that will be archived and put up on my webpage as well, including the recording of the webinar and the slide decks from the presenters. Okay, and I think the next slide is probably that's it. Yeah, so that's my presentation. I'm happy to address any questions, or if there's anything I can send to you as follow-up, I am happy to do that as well.
Thank you so much, Cheryl. That was great. So much information. And like Cheryl mentioned, I will also be including this PowerPoint in the recording, so you guys can go ahead and click through some of those links and see some of that stuff that she gave examples of. So I think we do have a few questions, and I will go ahead and give the floor to Darla this time. You guys can lead off with any questions you have for Cheryl, and then just kind of in general as well, because we are at the end of the presentation part of things. So
Thank you. I guess what is the number one advice that you would give to homelessness service providers who maybe weren't at the table in terms of community collaboration with public health systems before the pandemic, and how to kind of strengthen those partnerships now and make sure they're at the table and collaborating closely moving forward?
Yeah, that proverbial seat at the table is so important. I think Robert mentioned that earlier. So I think in all the resources, especially these toolkits and capacity building resources, we really talk about that and sort of try to lay out who are those partners. So of course, your local emergency managers, your local public health officials, these are the folks who really, and now also with the healthcare system, these are the folks who are leading these efforts right now. And they may or may not have a relationship with those organizations that support the needs of individuals experiencing homelessness. They may not understand your system. So you have something unique to offer them, which is that your clients may become their clients and vice versa. And so it's, I think, really helpful oftentimes to kind of find maybe a champion among your community who can find a way to sort of connect with those emergency planners and offer them that you can serve as sort of a liaison, that person who can, like, we know these programs, we know these populations, we know where they are, we know their needs, we know the supports that are there, and we can help you to help, because your job is to plan for them. And so we work with them every day to offer to kind of be that liaison, to kind of coordinate, to be an expert, a subject matter expert on addressing the needs of individuals experiencing homelessness every day, as well as in planning for emergencies and during response and recovery.
Thanks. I didn't get any other questions on my end.
sounds good. Okay, I will go ahead and shift the floor over to Lindsay for any questions that you have.
Thank you. One of the questions I think most appropriate for you, Cheryl, is many affiliates report seeing a significant slowdown in access to benefits such as SNAP and unemployment due to local agencies being closed. And naturally, those benefits are imperative for financially fragile families, as they might be seeing drastic and unforeseen changes to income or situations. And given that those agency staff are working from home, email communication is not always the best, most timely form of communication, and messages aren't being returned in a timely manner. Are there any guidance or suggestions for the states in terms of providing stronger support for families and individuals seeking services?
So I can speak for HHS a little bit. You know, the agency has been incredibly busy thinking about flexibilities, increasing access, and there's been money, for example, through the CARES Act and other funding that has gone out to states, in particular, and to communities, to make sure not only are we continuing to deliver services, but that we're increasing access and flexibility. So folks should not folks should not be encountering barriers to connecting people to these essential supports and services. Depending on where you are, you might have to, try some different avenues to reconnect. Some communities have the 211 system for referral. It might take, a phone call to elevate something to your state if you're not hearing, whether it's through, the USDA programs that are through SNAP, or the programs through Centers for Medicare and Medicaid Services or others. That workforce is still in place, and they should still be delivering services. And I would say it's probably might be helpful to elevate that to your state level representatives who run those programs, and try any kind of referral connection to kind of prompt any of those folks to be able to be responsive. It really should not be a slowdown. You should not be encountering barriers to connect people to programs. And I'm sorry to hear that. And if there's something specific I can help you connect with in your state, please let me know.
Thank you very much, Cheryl. The other one is potentially broader and may require an answer from another party on the line, but it was a question brought to the table, and that is, do affiliates have any liability if a family gets COVID and there is a subsequent outbreak in their program?
That I couldn't answer that. Maybe someone else on the panel.
And again, I'll repeat the question in the event that other ears may not have been perked, and that is, do affiliates have any liability if a family gets COVID and there is a subsequent outbreak within the program?
I think this Robert, I think that's really going to be more to a legal. I don't think any of us would be appropriate to comment on a legal issue. I'd encourage you. Most people have some sort of general liability with their insurance company, so that would be one place to go. The other is if you have a pro bono attorney to check with. I always remind anybody can sue anybody for anything now, and so it's not the issue. There's always some level of liability because everybody can get sued. The question is whether it'd be successful and how much cost is the defense. And so the one thing I know as a former provider is every state has very different levels on the Good Samaritan laws. So if you're not familiar with what your state Good Samaritan laws are, there's sometimes caps as long as you're acting in good faith. So, but I'd encourage you to check with either your general liability insurance carrier or an attorney.
Thank you very much, Dr. Marbut. That concludes the questions that I have prepared.
Thank you so much, Lindsay. I did get 2 questions from the audience a bit earlier, and I'm not quite sure who would be best to answer them, so I saved them till the end. But the first one is, as far as social distancing goes, what are your recommendations for families living in congregate living situations?
Martha, are you available for that one? Did you want to take that?
Yeah, sorry, can you repeat that question?
Yes, of course. And I think this may have been previously covered in other webinars, but just to go over it again, as far as social distancing goes, what are the recommendations for families living in congregate living situations?
Sure, so there are a few different places to look on our website for guidelines. We have, of course, our sheltered guidance and our unsheltered guidance for people experiencing homelessness. But then more generally, there are also a couple pages for people who are just living in shared housing generally, and also people who are living in close quarters. And you'll see the main themes are, trying to maintain physical distancing by staying at least 6 feet apart from other people that aren't within your household, and hand washing, being very observant to hand washing. And then there are also specific considerations for shared spaces as well as for cleaning and disinfection. So if you'd like, I'd be happy to share some of those links.
Thank you. Okay, and then one more question, which is actually a new one I haven't seen before, but would it be feasible to share a common area for a limited amount of time, such as like a dining room or a living room, with 2 or more COVID positive patients? Are there any risks to doing this?
Sure. So for anyone who is COVID positive, the important thing is to keep as much distance as possible. So, ideally, people who have COVID should have separate living and eating locations from anybody who doesn't have COVID. So I would recommend against sharing the same room with someone who has COVID. And then, other measures that are helpful in preventing transmission from someone who has COVID are things like, making sure they're using a mask if they absolutely have to be around other people. And again, observing hand washing, frequent hand washing. There's also a section on caregiving for people in your household if you have to provide care to somebody who has COVID-19 in your household, and some additional information on like who should use gloves and in which circumstances.
Thank you, Martha. That was great. And that was all of the questions that I had from the audience. Lindsay, or I'm sorry, my dog is barking. Lindsay or Darla, did you guys have any other last minute questions before we move into wrapping it up?
None on my end, thanks.
None on my end either.
Wonderful. Well, I think on that note, Dr. Marbut, did you want to say anything to wrap up? And then I'll hand it over to
Just
Darla
want
and
to
Sandy.
just want to thank everybody for your service and for the amazing work you've done already, and for your patience to get us through the next few months here. Just thank you, and keep up the great work.
Thank you, Dr. Marbut. And Darla?
Yeah, I just want to thank everyone for joining us today. A special thank you to our federal partners for taking the time out of their busy days to give us the latest information and tips and let us know where more resources and information are. And a special thank you to all of you who have tuned in today, who are on the front lines serving youth, families, and children experiencing homelessness. Thank you for all that you're doing every day. I know it's been a lot over these past few months, and we have a ways to go. And we're just grateful to walk with you and hopefully provide you with the latest information that you need. And a special thank you to Family Promise. It's really been great to partner with you on this webinar today.
Wonderful. Thank you so much, Darla. And thank you to Dr. Marbut and Cheryl and Martha and Sandy and Lindsay from my team as well for joining. For Family Promise affiliates, this recording will be on the Family Promise webinars page, and I will make sure I share the webinar with Darla for the National Network for Youth participants as well. So thank you all again for being here and for the great information and sharing your resources. I hope you enjoy the rest of your afternoon.
Great. Thanks, everyone. Be well.